Again, tonight we come before this body as the Congressional Progressive Caucus with the progressive message. The progressive message, this idea of coming before the American people, projecting a progressive message so that the people of the United States can say, you know what, there are people in Congress today who are willing to stand up and say that ideas about generosity, of justice, of peace, of inclusion, of universal health care, of providing access for everyone. These are principles. There are people who will, in that Congress, who will stand up for these ideas, and that is the Congressional Progressive Caucus.
And as we all know, the United States is the only industrialized nation to not offer universal health care to its citizens.
The question was posed, will you, meaning the Congress, vote against a reform plan without a public option?
In my view, if we have a plan brought out on this floor without a public option in it, it is not universal coverage, because that means the insurance companies have won the whole game. And if they believe in the free enterprise system, then they believe in competition. And they ought to be able to compete with a government plan that's well done and not given any special advantages, just the fact that it's going to be done without profit. So you're not going to be worrying about, insurance companies worry about profits for stockholders. The government doesn't worry about profits for stockholders. It worries about giving services to human beings. That's why the administrative costs in Medicare are so much less than those of an insurance company. So I can't imagine myself voting for a plan that does not have a public option. Now people say, why do we need a public option? You need the competition of the public option to drive the health insurance industry prices down.
It is important that for people to know we have this burgeoning coalition of people who want to see single payer or at least want to see a public option. Clearly, we know that the forces of labor would like to see this public option, and many of them call for single payer. We know that the Chamber of Commerce has said we need health care reform. They might not be calling for single payer, but some are. We know doctors are. But also, as you pointed out, it's critical to know small business people would benefit from single payer or at least a public option. How will you stop denial of pre-existing conditions? And I yield back to the gentleman.
You essentially make a decision at the federal level that we are going to require all insurance companies to take everybody. They cannot use pre-existing conditions. When we come to a national health plan that Barack Obama is going to sign, it has to have a national standard that every insurance company has to cover everybody.